Hello, everyone. Um, I'd like you to take a moment and imagine that you're drowning, that you're gasping for air, you're exhausted, you're looking desperately for anything to grab a hold of. And relieved, you see a ship full of your familiar faces of your friends and family. You lurch forward, reaching for help, and you are suddenly thrown concrete blocks. And as you're being dragged down into the murky depths, you look back to see your friends and family close their eyes and turn their backs. And this is what it's like as a suffering alcoholic or addict attempting to navigate the ocean of addiction with our current resources that are available, the stigma of society, the medical fraternity, and even our inner circles. We live in a world where addiction is criminalized more than it is treated, where stigma overshadows solutions. In 2006, I found a solution to my problem, my drug and alcohol addiction. And I've been searching for an answer since 1987. And that's why I say I've been in recovery since 1987. And I finally found a working solution, a practical approach that I could practice every single day to stay free. And I learned two things. I learned one, abstinence alone is not the answer. It doesn't solve all the problems. It doesn't heal the hearts. It doesn't mend the broken relationships or families. Abstinence is just a beginning. And the second thing that I learned was that I was called to help as many people as I could that were still suffering. And so I embarked on my professional treatment career. And I've got to tell you, it's been a heck of a ride. I've helped to open and establish several recovery organizations, from sober living homes all the way to nationally recognized and prominent co-occurring disorder treatment. I have helped thousands of men and women and their families find a solution and be on the path to recovery. And after 11 years, I became very disillusioned. I saw genuine human suffering being reduced to insurance policy benefits. Behind the curtain, people were treated as insurance policies, but in front of the curtain on stage, they were given memorable vacation spa-like experiences that didn't provide a practical solution, and it invariably provided one of two outcomes. One, recidivism, which is good for business if you're a treatment center. Or two, suffering, misery, and death. So I knew that things had to change. I knew that this couldn't be where we end up. So I created a program. I had this idea to create a program that stripped away all the amenities and focused solely on reintegration into one's family, seeing their value in themselves, their family, and their community, and finding a practical solution that would engage alumni that would come back and help men early in recovery find their way through this path, and that it would also engage the local community. Let me take you back to 7 years ago. I'm standing before the town council in Hubbard, Texas. And I wish I could tell you it was really super fun. And I'm very excited to present this idea to the town council. And I'm very confident because this building I'm about to take over was recently vacated by a women's treatment center. So my confidence was high. I thought it was just going to be a 5-minute little meet and greet. And the meeting started, and bam, I was ambushed by fear. I was ambushed by stigma. I was interrogated for 20 minutes by 3 council members while the rest of them stayed quiet. And I was very confused. I also discovered that there was a petition being signed and passed around the town to shut me down before we even opened our doors. Not in my backyard was in full effect. And I couldn't understand why. Why would the good people, and I know they were good people of Hubbard, why would they react so forcefully about men seeking help, men looking for a solution? Back to today. I know that I'm standing in front of good people. How do I know this? You're here. You're open-minded, you're seekers, you're exploring new ideas that will hopefully enhance your human experience, that will one day manifest into some action that inspires someone else to do the same thing. And that's what good people do. And that's what I believe about all of you here, because you are here and you are exploring. But there's a very apropos quote. It's anonymous, and it effectively states that the only thing necessary for the triumph of evil is that good people stand by and do nothing. Why is it, when it comes to addiction, that there are so many people in the do-nothing camp? Is it that you don't believe the problem exists, or that it doesn't apply to you? You're not affected by that? Is that you? Or are you one of the many who don't subscribe to the idea that addiction is a disease? You feel it's rather a choice because you can take it or leave it. Why can't they? Is it because they're weak or undereducated, maybe raised by wolves? Is that you? Or are you so paralyzed by stigma, like so many addicts and family members are? You're so afraid of public scorn and judgment that you are paralyzed and you don't ask for help or for advice for you or your loved one. You see, stigma is an insidious force. Its breeding ground is fear. And we often fear what we don't understand. So let's take a look at the facts. And that is that the U.S. Department of Health and Human Services and the National Institute of Mental Health suggest that approximately 49% of the U.S. adult population suffer from some form of addiction, whether it's substance use, alcohol, nicotine, including vaping, gambling, video gaming, and even eating disorders. Now, that number does not take into account any overlap, I get that, but it also doesn't include process addictions like TV, social media, technology, and even, dare I say, shopping. There's really a lot of data that's left uncollected. So take a look at the room. Take a look around you. Go ahead, take a moment. That means, statistically speaking, half of this room suffers from some form of addiction. Now, you don't have to raise your hands. You don't have to introduce yourself and say, "Hi, my name is." But that's staggering if you look around this room. So I take this wonderful idea that I've got about this wonderful program, and I realize that I have, in that moment, while I'm standing in front of the town council, I have two options. I can, A, hang my head and hide my program behind a veil of shame, or I can take that stigma and break it. I decided to break it. And what I did was I engaged the ambassador of Hubbard. His name is Eugene Fulton, and he saw our vision of community, and he embraced it immediately. He gave us our very first project, which was to clean out what we call in Texas a calaboose. And what that is a very old, the one that's in Hubbard, it was built circa 1908, and it's a jail, 2 cells. I mean, you definitely do not want to be locked up here. But it was to clean it out. And some of those old ideas that we believe in, and some of those stigmas that we believe in, were probably formed right around 1908. And so it was a very symbolic impact that we could have, not only just in a literal sense, but in a figurative sense also. And then we began to evolve our voluntary projects. We went from the city campgrounds to playgrounds to helping the elementary school teachers set up their classrooms for the following year. We then began working concession stands for Friday night football games and volleyball games at the high school. We even mentor kids in elementary school for math and English and reading. What ended up happening was an entire community stopped throwing concrete blocks. started throwing lifelines because the town leaders and the people of Hubbard started to really embrace us, and they saw that we're just people too, and that we all have struggles, and we're not defined by them. The same riffraff that the town was trying to protect from their children sent their elementary kids to our facility to sing Christmas carols at Christmas, right? Right? We were given an award by the City Chamber of Commerce that for Volunteer of the Year award. We were recognized by the state senator for our community efforts. And I'm telling you, this community didn't just throw lifelines to the men threw them back, and then to each other, and this entire community pulled together in a way that is miraculous, really, and healing, and we look at each other now as equals and not as raised by wolves or lesser than, or that we don't have a moral compass that points due north, that we're genuinely people who suffer just like everyone else. And so I've talked enough. I'd like to invite you to take a look at some of these quotes from the good people in Hubbard. Carolyn Wren, a local Hubbard resident, said, "I recall people being scared and very upset at first, but now I think the community couldn't imagine it not being one of its best assets. Seeing those men and their families recover is a true inspiration." Now, Mary Alderman was the Hubbard city mayor that was also in term 7 years ago. And she says, "The men in this program have given us so much more than we could have ever given them." And then finally, Misha Trompler, who heads up that tutoring program, said, "The kids aren't weighed down with stigma. They see the men as loving and patient and willing to help. The children see these men as role models that they don't have at home." So from riffraff to role models, we're not going to make sweeping changes to the addiction recovery system. We're not going to change the insurance company's involvement. But what can we do? We can come together as a community. We can embrace each other. And in the big picture, there's things that we can do. In the big picture, is there anyone here who has the space available that they can offer people in recovery to meet, peer groups? Is there anyone here who could has the skills and resources to provide educational workshops for addiction awareness? Is there anyone here who can do that? Is there anyone here who can partner with nonprofit organizations that help provide the resources people need to begin their journey in recovery? Now, if we can safely bring it to here and now, what can you do today? Well, I'm going to ask for one more little act of community engagement, and that is, if you have the courage today, right now, to break stigma, if you have the courage, if you have been affected by, directly or indirectly, by alcoholism or addiction, please raise your hand. Okay, keep in there. And everyone turn around, take a look. See, it's not those people. It's our families, it's our friends, it's our neighbors, it's our communities. We don't need a war on drugs. We do need a war on fear, because as we've just seen, we're all in this together. Thank you.